and thank you for joining us for today's National Conference of State Legislatures online meeting, Drunk and High Behind the Wheel, Tackling the Growing Threat of Polysubstance-Impaired Driving. My name is Samantha Block, and I'll be your moderator for today. I joined NCSL's transportation program in 2019 and am NCSL's expert on alcohol and drug impaired driving, distracted driving, and other traffic safety issues. This is the first online meeting in our traffic safety online meeting series, and we hope you can join us again next Wednesday for a traffic safety roundtable, which will feature a dynamic discussion around traffic safety trends with a focus on alcohol and drug impaired driving. Before I introduce our speakers, I want to review a few housekeeping aspects with you. I want to remind all attendees that NCSL's meetings are open to the media. Be aware, media could be in attendance for today's meeting. All media must properly ID themselves on the name header. Any recording of this meeting by private individuals or outside organizations is not permitted. All participants will be muted during the presentations. However, we want to encourage participation through our chat box, so feel free to type your questions and answer any questions in the chat box on your screen. After the presentation, we will break out for small group discussion and will hold a formal Q&A after reconvening. Today's meeting is being recorded and will be available together with the PDF presentations on NCSL's website within the week. Discussion in the breakout rooms will not be recorded, and we will send attendees a link to all the resources. If you experience any technical difficulties, please mention this in the chat box, and one of my co-hosts will be ready to assist you. Very quickly, for those of you who don't know NCSL, NCSL stands for the National Conference of State Legislatures. We are a membership-based organization providing services to legislators and legislative staff in all 50 states and territories of the United States. We provide legislative staff and legislators with bipartisan research and opportunities to connect with other legislators and staff and to policy experts to discuss what is or isn't working in their states. But let's get back to why we're here today. Polysubstance-impaired driving, which is driving while under the influence of a mix of drugs or a combination of drugs and alcohol, appears to be a growing threat. A clear trend in states to legalize recreational and medical marijuana and ongoing initiatives to add other impairing substances to the list of legal drugs might exacerbate this issue. Impaired driving is a grave public health threat, whatever the impairing substance, and we are not dismissing the seriousness of any form of impairment. However, drug and polysubstance impairment present particular challenges that will need to be solved if we want safer streets. One challenge stems from the difficulty in interpreting existing data, since the presence of drugs in a person's body does not necessarily mean that they were impaired while driving. The lack of complete and consistent data regarding drug prevalence in impaired drivers is another major obstacle. In recent years, at least 5 states have passed legislation aimed at improving data collection and reporting of driving under the influence of drug offenses. For example, in Colorado, since 2017, the Department of Public Safety has to report annually on substance-affected driving to the General Assembly. NCSL tracks policy and legislative trends related to alcohol and drug-impaired driving. We have several useful online resources, and you can find links to those resources in the chat box now. Today's presentation will provide an overview of polysubstance-impaired driving and oral fluid testing laws. We want to thank responsibility.org for making this online meeting possible and for lending their expertise and leadership to this important and timely traffic safety topic. Presenting today are Darren Grondell and Jake Nelson. We will hear from them one after the other. Each will have approximately 15 minutes, and they will have slides accompanying their presentation. You can access their full biographies through the links in the chat box, but let me quickly introduce our expert speakers. Speaking first, we have Darren. He is the Vice President of Traffic Safety and Government Relations for Responsibility.org. Daring previously served as the director of the Washington Traffic Safety Commission from 2012 to 2020 and retired as a captain in 2017 from the Washington State Patrol after 25 years of service. Next, we will hear from Jake. Jake is the Director of Traffic Safety Advocacy and Research for AAA. He is a trained epidemiologist who began his career as a researcher in the medical field and shifted to applying his skills in the real-world application of statistical data and rigorous academic research to reduce crashes, injuries, and deaths on the nation's roadways. Darren, thank you so much for joining us today. The floor is now yours.
Well, thank you, Samantha, for the warm introduction and the invitation to be on this webinar. At responsibility.org, we would like to thank you and all of the members of the National Conference of State Legislatures for hosting and being able to put this webinar on, especially Doug Schinkel, our Transportation Program Director, for the great assistance and the information and feedback we've had to put this on. We are thrilled this webinar has attracted so many people, and I understand that this is one of the largest gatherings for an NCSL webinar in a long time, and so we're grateful for that. But it also really shows the interest in this particular topic, the growing trend, the issues that are surrounding the polysubstance impaired driving, and also what can we do about it. So you're going to hear a little bit about those roadside drug and alcohol testing technologies that can help us an officer's roadside to make better decisions. Next slide. So in our namesake, responsibility.org is committed to responsibility. We actually started as an organization in 1991 with a threefold mission. That is to eliminate drunk driving and work with others to end all impaired driving. It also is to lead efforts to eliminate underage drinking and also to empower adults to make a lifetime of responsible alcohol choices. You know, as an organization, we have invested over $300 million in various policy development, educational programs, public awareness campaigns, and new resources that are coming out. Especially today, we came out with 3 new publications. One is on a cannabis impairment detection workshop handbook, a guide for DOI pretrial services, and also a law enforcement guide for courtroom testimony. So we spend a lot of time in this arena addressing impaired driving. So next slide. Responsibility.org is funded by the leading distillers in the United States, enhancing a legacy of responsibility and recognizing the power of collective action, which takes great partners. Next slide. This is just a sampling of many of the partners that we work with and associate with to address impaired driving through various research, evidence-based countermeasures, and innovative ways and technologies to eliminate impaired driving. It takes all of us working together to address this issue of impaired driving. When I mean impaired driving, especially it means around the poly or multi-substance use of various substances. So when we talk, next slide. So when we talk about polysubstance use, what are we actually talking about? This is the use of 2 or more substances that somebody uses and consumes, and then gets behind the wheel of a vehicle. So that's kind of what polysubstance. And many people think that when we talk about polysubstance, we're only speaking about drugs. That is not true. It's a combination of all substances mixed together, whatever they might be. As you can see through the picture, it could be drugs and it can be alcohol. Does it include alcohol? Absolutely. And unfortunately, we see too many tragedies with combinations of alcohol and combinations that are out there. You know, responsibility.org is really focusing because we look at eliminating drunk driving, but also as part of that is eliminating all forms of impaired driving. So when we talk about polysubstance, it could be interchanged with multi-substance use. So it includes all substances that are impairing out there. Next slide. We have national data on drug driving. Well, I should say that national data on drug driving is very difficult. There's really no good national database that we can use and pull from to get the good timely data that we need. We've had roadside surveys that have been done since like 19 1976 up through 2013-14. In 2013-14, the last National Roadside Survey that was conducted showed that about 22.4% of the time people tested positive for a drug presence. Now, as mentioned earlier, presence does not equal impairment. But also, this National Roadside Survey also gave us a pretty good indication of what we're seeing on our roadside. And then seeing illegal drugs, including marijuana at 12.1%, 15 on weekends. Medications, we see differences between weekdays and weekends. Marijuana stayed about the same, at least at this time period, but now with all of the legalization efforts, would we start to see increases in that? And then with alcohol, we saw some significant decreases in use of alcohol over that time period, but through COVID and other things, are we starting to see some of those things creep up? So I would ask, and just as we go through this, looking at how do we improve data systems, and one of them is it's time to repeat the National Roadside Survey. You know, when I was the State Highway Safety Office Director in Washington, we did this National Roadside Survey separately in preparation for the legalization of marijuana pre-sales. And we found very similar data. Obviously, we found some increases in cannabis use after sales. But we need Congress to reauthorize the National Roadside Survey for data collection. And we've identified some ways to improve that research methodology to allow this to be more effective and to address the issues that were raised with that. Next slide, please. You know, we have significant research identifying about alcohol and the various levels of impairment at what stages you are. We know what the blood alcohol concentration level is and those types of impairments that you would see at those various levels. However, there is no empirical evidence to show what that level would be for cannabis. In essence, there's no BAC for THC. As noted in this slide, there are a multitude of reasons why, and the same for other drugs. You know, with the variations that we see with cannabis or other drugs, we see that how individuals may respond to that, frequency of use, chronic issues, those things all raise the level that will we ever have an actual level of impairment. So right now, the research shows that there is no level of impairment other than what we see as the officers roadside being able to see through standard field sobriety tests, the driving, the observations, and making those, calling in a drug recognition expert to help assess and evaluate and making those good decisions roadside. Next slide, please. You know, some of the emerging issues when I was in Washington, we went back to 2008 through 2016 to look at the data because many of the FARS data at the time only allowed for 3 substances to be entered into the national database. So we went back and pulled every toxicology report from 2008 all the way through. And we saw the issues of about 36% of fatalities involved alcohol only. 44% was poly drugs or any combination of substances together. 12% was only one drug, which did not include alcohol or THC. So we saw a lot of other substances, and then 6% of that was THC. So we do see this continuing to increase over the years. Next slide, please. When we look at the complexity of impaired driving and public perceptions, we did a survey many years ago in conjunction with the Governor's Highway Safety Association and looking at drugged versus drunk driving. There's hundreds of drugs. Alcohol is alcohol. We've seen where use by drivers and the presence in crashes the data is very limited for drugs, but for alcohol, we've got abundant data. Use by drivers has been increasing for drugs. And also for alcohol, we've seen at that time in the survey, we saw that there was decreases. But impairment, when it comes down to that, especially for drugs, varies by type. And also we see for alcohol, it's very well documented of what we see for impairment. And then what really was surprising for us is the beliefs and attitudes. Part of our own culture that I think we look at is for drunk driving is, oh, that's socially unacceptable. But for drugged driving, do we look at it the same way? But what we saw from survey respondents is that there was no strong attitudes or there was almost a public indifference in that. That's why this webinar is so important, is to be able to realize and recognize and really help change that perception that drug driving is dangerous and should be also socially unacceptable, especially when it is causing impairment. Next slide. You know, just seeing some of the news reports around the country, and I just highlighted this because it happened just a couple of weeks ago, but this was in Missouri, where a Utah man was stopped for 130 miles over the speed limit, or actually it was 130 miles an hour, which is way over the speed limit. But he smelled of alcohol, and he also related later and said that he was using Adderall, LSD, and alcohol. You can imagine the combinations that he had. And he was also intent on killing Senator Claire McCaskill, which totally unacceptable. But you can see where these combinations of substances have an impact on road safety. Next slide. So you look at data, and how does data drive the narrative? How does it drive us to make action and make changes? In looking at the fatality numbers that involved drug positive drivers with known drug results, also looking at the percentage of traffic deaths in which at least one driver tested positive for drugs, has nearly doubled over the last decade. And if you go to the next slide, in 2018, 8,867 people were killed in vehicle crashes where at least one driver tested positive for drugs, accounting for over 24% of the fatal crashes. 23% of the fatal crashes involved drugs. At least one driver tested. So you think about some of these issues, it isn't just a one-off. This is something that's happening in all of our communities. And if you take a look at your data, you will see that this is a growing trend and problem that really needs to be addressed. Next slide. In Washington State, we saw this right after legalization, where we saw our multi-substance impaired driving issues starting to really creep up, from about 82 a year to over 172 at the high point in 2016. And then back in 2018 at 152 fatal crashes where somebody had multiple substances in their system. Next slide. Oh, back one. And you think about the various drug categories. Our drug recognition experts are trained, they're experts. They are looking at various types of examples for the evaluation itself, different drugs that might be within those categories, the indicators that are along that way, and another reason that we need to have really good trained DREs to look at and see the various drug combos that we're seeing roadside. Not just looking at alcohol and taking the easy way out, but looking at the whole picture 360 and evaluating that completely. Next slide. We see in the data, various data sources. This just came out. Thank you for the National Highway Traffic Safety Administration and the researchers that have been working on this. This is from 6 different trauma centers around, I guess, in Eastern United States. And it's not generalizable data, but the interesting part is that this particular data helps to show a growing and interesting need to address impaired or multi-substance. Alcohol use is still up, and we will never take our ball off of alcohol from responsibility.org. You look at the various drugs themselves, cannabis, this is pre-COVID and during COVID, seeing the increases that we have seen with that, opioid use, and other substances with at least one category. So just looking at some of the data sources alone around that is seeing, we're seeing these increases around the country. Next slide. When you look at commercial vehicle carriers, this is from the Drug and Alcohol Clearinghouse from the Federal Motor Carrier Safety Administration. Take a look at some of the samples there, especially in the middle with marijuana metabolites at over 10,000 positive drug tests with marijuana metabolites, cocaine metabolites, amphetamines. This was actually a sample as of June 1st. So in the first 6 months of the year, because this came out in January of 2020, positive drug tests account for 80% of the total violations reported on commercial vehicle carriers. So another area of taking a look at data and seeing where do we have some of those issues. I'm not saying it's just commercial carriers, but it's all drivers, and looking at some of these samplings. Next slide. So at responsibility.org, we are very concerned about the multi or polysubstance use. And earlier this year, our national board approved 3 new policy statements. One on multi-substance impaired driving and the impacts and needs for change. oral fluid screening and for impaired drivers, and also increased testing for impaired driving cases themselves, improving the standardization of toxicology screens, improving the timeliness of response for labs to be able to get those to the court, and addressing those accordingly. Next slide. So as we are very concerned about this and looking at this holistically, is as an organization, we are working with some other organizations that have been supporting of this idea. One is Abbott Laboratories, also to look at this as an issue of creating an organization or a national coalition called the National Alliance to Stop Impaired Driving. Next slide, please. This national alliance would be one that would be organized, coming together to be a national voice, bringing all of our resources together. Many of us are working in silos, many of us are working independently, but how do we bring those resources together to address this multi-substance impaired driving? And what are the resources and technologies that we could bring to address this? So why are we talking about creating a national coalition? Well, for drug and multi-substance impaired driving is increasing, as we've notified or noted. COVID increases in risky driving will demand attention and opportunities at both the state and federal levels to help to address federal and state policy issues to address this, and also the issues of technology. Now, this coalition is kind of a spinoff from what we've been doing in Michigan on an oral fluid pilot there. That group said, how about we take this state coalition and make it a national coalition? Brian Swift, who is also on this call and pictured here, he turned tragedy into action. His parents were killed by a log truck driver up in northern Michigan who was only under the influence of cannabis and killed both of his parents. It's taking him 7 years to help see and bring about change. And we feel like that is way too long to help bring about that change. So this organization would help bring about that, bringing experts from all around the country, bringing people together to help address this. Next slide. The mission of this organization would be really to eliminate all forms of impaired driving, especially multi-substance, through the DOI system reforms, detection, and improvements in technology. The National Alliance is a broad coalition of stakeholders working in a public-private partnership to achieve these goals, which would incorporate many folks from many disciplines within the DOI system. And even those may not be directly involved in the impaired, but may be impacted by it, like employers that could be involved with this group. And the purpose is to eliminate, and at the end of the day, is to eliminate all forms of impaired driving and finding solutions and supporting the resources that we need out there. This is actually the first public announcement that we've been making about the National Alliance, and we hope that as you consider that you could be a member of that. Next slide, please. So we talk about some of the goals that we are looking at in promoting the emerging technologies with this. Establish drug and multi-substance impaired driving as a top priority issue, especially with Congress and with our state legislatures. Persuade the public and decision makers to expand drug testing, not only roadside, but also within our labs. And then also promote oral fluid tests and other emerging technologies as a must-have. You know, ensuring greater exposure to this, how it works, the reliability, the effectiveness, kind of demystifying some of the issues that are around some of the technologies, and really looking how do we promote that. Building champions around multi-substance and really addressing this is not just well, that's just impaired driving, because this kills way too many people. Convene influencers from around the country and also assist practitioners with training and education. Next slide. And as you look at this visual concept, this is kind of what we look at. These boxes identifying various industry groups or advocacy groups is only a sample of what we envision of creating with the National Alliance to Stop Impaired Driving. Focusing on policy and promoting technologies, public awareness and education, training and state implementation, and really taking serious the impacts that impaired driving has, and not just treating it as just a minor crime, but a serious crime that needs to be addressed from all aspects, from the arrest, adjudication, and then through treatment. and all of those things that can help make a difference in not only our own quality of life, but the quality of life that those that are been driving impaired, because there's a lot of deep psychological issues that go along with that. So how do we work together to address this 360? Next slide, please. So if you would like to be a member, and I would encourage you to, is to contact me. Here's my information, my email and my phone number. We have more information that will be coming out, but in the time allowed, please reach out to me, and I'm excited to be able to see this national group being working together. And I will turn the time over to Jake.
Thank you, Darren, for your presentation. Jake, you're next. Take it away.
Thank you, Samantha, and thank you, Darren, for teeing up my portion of the talk today. I think based on what Darren shared with all of you, it's pretty clear that there is a growing demand for some way to quickly detect drug-impaired drivers at the roadside. Sort of a breathalyzer for drugs other than alcohol. And so one of the things I want to accomplish today is to share a little bit about the use of oral fluid as a sample to detect drugs in the environment of impaired driving prevention. But I want to make something super clear, is that what gives blood alcohol concentration its power, and therefore per se standards across the states, is the established relationship that exists between how much alcohol is in our blood and the crash risk that we can observe. And that relationship isn't established for any other drug except for alcohol. And so even if you have a device that can quickly detect, one or more drugs in the oral fluid of a driver, a suspected impaired driver at the roadside, that result, even if it's accurate 100% of the time, doesn't prove impairment. So it doesn't give us the same sort of power as knowing what somebody's blood alcohol concentration is. And so I want to make that super clear right now. But that's not to say that there isn't really great benefit in being able to collect additional evidence in the context of a drug impaired driving case. And so I'm going to dive into a little bit more information about that now. Next slide. And I think probably one of the most useful places to start is to talk a little bit about the words that we use when we talk about oral fluid, testing for drugs using oral fluid. We have to be careful when we use the word testing versus screening. So roadside screening, this is, a law enforcement officer collects an oral fluid sample at the roadside during a traffic stop, gets a result in about 10 minutes, and has some information that may suggest that that a particular motorist has one or more classes of drugs in their body. So let me switch gears here just for a minute to cancer. So there are lots of screening tests for cancer, and we would not diagnose somebody with a form of cancer based on the results of a screening test. And that's because screening tests are not always accurate. And the same concept applies in this case. So we can have the result of a roadside screen for one or more classes of drugs in the body of a driver, but we can't rely on the accuracy of that information for the purposes of evidence in court. What we need for that is an oral fluid sample sent to a forensic laboratory, to a toxicology testing environment where more rigorous testing and analysis can be done. And those results are the results that become evidentiary or can be admissible as evidence in court. Sort of the confirmatory testing. And so I think it's common for those of us who work in highway safety and for policymakers to be loose with the words that we use when we talk about oral fluid drug testing. Most of the times we're thinking of what would happen at the roadside. That result that we would get in real time in 10 minutes during a traffic stop. But that's really roadside screening. And so as I go through this presentation, I'll use the term screening and testing appropriately, or at least that's my goal, because there are very different implications of the results of each of those. So the results of a roadside screen, what you get within 10 minutes during a traffic stop, produces information that can be used to build probable cause for the arrest, for a search warrant, to get a blood draw, or to get a secondary oral fluid sample to send to a laboratory for confirmation testing. The results that you obtain at the roadside, that's not evidence that can be used during a court case, a DUI court case. In an probable cause hearing, yes, but not during trial. It's the result of the lab-based test that's evidentiary, that can be admissible in court for a DUI case. So two different things that we're going to talk about today with different implications. So there are strengths and limitations of roadside screening versus lab-based testing. And so I'm not going to give you an exhaustive list, but I want to share some of those with you. So some of the advantages of roadside screening using oral fluid. You can identify recent drug use. It's easy and fast to collect, minimally invasive, similar to a breath test. Rapid results in under 10 minutes, as I mentioned before. Used in conjunction with the other kinds of evidence that you heard Darren mention before through what's observed, what does the arresting officer smell when they do the traffic stop, the results of the standard field sobriety test, those kinds of information combined with the results of a roadside drug screening test using oral fluid can help build probable cause for arrest and for a search warrant if needed. Some of the disadvantages or limitations to the use of oral fluid in roadside screening specifically is that not all these devices are created equally. Not all of the devices on the market have the same sensitivity and specificity. They're not accurate to the same degree and reliable in the same way. There are sensitivity concerns around certain kinds of drugs, for example, benzodiazepines. These roadside screening devices often are limited in the number of drugs that they can test for in real time at the roadside. Those limits aren't really applicable in the context of lab-based testing, where there's more technology available. So switching gears to the lab-based or evidentiary testing, or confirmation testing, as you can describe it as well. Again, fast and easy collection of the oral fluid sample. One of the greatest benefits of using oral fluid, either in addition to or instead of blood in this environment, is that you're able to collect the sample at the roadside, closer to the time that a DUI suspect was actually driving or committing their crime. As compared to, on the average, about 2 hours after the traffic stop before a blood sample is typically drawn. And for drugs other than alcohol, depending on the drug, your body can break it down very rapidly. And therefore, the amount of the drug, or even the ability to detect the drug at all, is significantly impacted by how much time passes between when the individual was driving and when the sample was taken. So the ability to collect that oral fluid sample at the roadside and then send it to the lab for confirmatory testing is really valuable. So it's one of the biggest benefits of using oral fluid to detect drugs in impaired driving cases. There is low likelihood of specimen contamination or adulteration. Short window of detection means that you can likely capture recent drug use, which is important in these scenarios. And some of the limitations is really the cost. And that includes not just the cost for training and education of lab personnel and other members of the criminal justice community, like law enforcement officers who would have to receive training on how to collect these samples, but it's also all the equipment in laboratories that a lot of labs don't have. So a lot of labs are equipped for certain kinds of testing, whether it's urine or blood, and fewer are set up to test oral fluid in these ways. And so that is a huge barrier for a lot of laboratories and a lot of states, and even within states in different counties. So let's go to the next slide here. Samantha mentioned at the top of our call today that we're going to talk a little bit about state laws. So that's where I'm going to jump to next. Next slide. So there are really three primary ways that the use of oral fluid for drug screening and or testing can be permitted within a state. So one would be through a state's implied consent law. So implied consent is basically an administrative law really designed to encourage motorists to submit a sample for chemical testing in the context of an impaired driving case. And some states cover the collection of oral fluid for those purposes. Another way that many states provide for the collection of oral fluid for this purpose is just elsewhere in their DUI statute. So it's not covered by implied consent, but their DUI law generally allows for it. And then the last example would be either temporary or sort of longer term ability to collect oral sample or oral fluid for the purpose of detecting drugs in impaired drivers for pilot or research purposes. And so you heard Darren mention the state of Michigan, that's my home state, is doing a statewide phase 2 oral fluid drug screening and testing program pilot right now. And so that's another way that state policies or laws can provide for the ability to collect and use oral fluid to detect drugs in impaired driving cases. Next slide. So let's dig into this a little bit more. Key things that the law needs to do, it needs to permit the collection of a sample. And it also needs to permit the ability to test that sample for drugs other than alcohol. So I'll talk about more about that in a minute. So right now, or at least as of October, 40 states can check both boxes for blood. 23 states can check both boxes for oral fluid. But in practice, only a handful of states actually collect oral fluid for use in the context of impaired driving cases regularly. Next slide. So this is really what the lay of the land looks like as of October. And as you can see, Michigan's the only state there highlighted in yellow because they have their statewide pilot program. And as I said, there are just a few states that in practice collect and use oral fluid in the context of impaired driving cases on the regular. And so what I want to do next is dive into a few examples of what some states are doing. Next slide. So in Indiana, this isn't true of every law enforcement agency in the state, but based on a survey that the AAA Foundation did, we learned that in Indiana, their implied consent law covers or provides for the collection of oral fluid in the context of impaired driving cases. They use oral fluid drug screening at the roadside to not only build probable cause for arrest or for search warrants, but also to make a determination of whether or not to summons a DRE to assist on a particular case. Next slide. In Michigan, as was mentioned by Darren and that I spoke to just a moment ago, they have their phase 2 statewide oral fluid drug screening and testing program underway right now. So their implied consent law in Michigan does not extend to cover oral fluid, but an exemption was made for the purposes of this statewide program. And in the state of Michigan, only drug recognition experts collect oral fluid specimens for roadside screening and for confirmation testing in the lab. Next slide. So Alabama, which many would say is sort of a gold standard for how a state could or should run the use of oral fluid drug screening and or testing program should they decide to move in that direction. So in the great state of Alabama, the collection of oral fluid isn't covered by their implied consent law, but is covered elsewhere in their DUI law. They have an oral fluid drug screening program and also an evidentiary program in the state lab. And in Alabama, law enforcement officers collect both samples at the roadside for use for screening purposes, and also the second sample is sent to the laboratory for confirmation testing. And I believe in Alabama, they're still collecting blood as well to sort of triangulate the data that oral fluid and drug both provide. But I also believe that they're moving in a direction to hopefully one day shift away from blood for at least in the context of impaired driving cases, and to focus on oral fluid. Next slide. So in Vermont, just this year passed a law to start an evidentiary, not a roadside screening program for the use of oral fluid in the context of impaired driving prevention. But in the law that passed, there's one big problem. And that problem is the way that the law is written in Vermont is that the sample, the oral fluid sample, cannot be collected at roadside. And as I mentioned at the top of my time together with you today, the single greatest benefit of collecting or using oral fluid for the purposes of detecting drugs in drivers is the ability to collect the sample as close as possible to the time that the suspect was behind the wheel of the car and operating a motor vehicle. So if in Vermont, the law isn't sort of amended, or in terms of how the program is run, it's not changed to allow for the collection of that sample at the roadside, there's really no value to having an evidentiary program using oral fluid because we're sort of knocking the value of the program out at the knees. So it's really important that we don't try to sort of ram these programs through, that really do it thoughtfully and involve the right people to make sure that we don't unintentionally create these kinds of loopholes. Next slide. So there are some complicating factors here, I think, worth sharing. And I mentioned, or shared with you the example of the loophole in the state of Vermont just now. But there are other examples that I want to share with you too. So even just for blood, I'm not even talking about the use of oral fluid right now, even just for blood in those 40 states that are blood states, is there are loopholes or exemptions that limit who can collect the specimen, and what kind of environment that specimen can be collected, regardless of who's collecting it. Some states allow the testing of blood only for specific drugs. Like drugs are itemized in the law rather than just any impairing substance. So other states require that only controlled substances can be tested, or substances that are regulated by the FDA. So that would exempt drugs that don't fall into those categories. And I think of a few years back, an example that comes to mind is in the state of Florida, Ambien, a drug that when it does what it's supposed to do, makes you fall asleep. You couldn't be convicted of impaired driving in the state of Florida for that reason, because of that exemption. So these are the kinds of, I think, loopholes and exemptions that we should expect to see as more states move in the direction of oral fluid drug screening and or testing as well. And so we need to be really thoughtful in the way that we craft these laws and form these programs. And I'll talk a little bit more about how we can do that in just a moment. So lawmakers also do not typically understand the complexity of setting up these programs. And I don't think that we can really expect them to understand it without help from people to clarify what the loopholes are and the kinds of considerations that we need to keep in mind when setting up these programs. And then obviously there's the issue of funding. And I mentioned this a moment before, is if a state is set up to collect and to test for blood, and even if there was the willingness and ability and the law within a state provided for the ability to do it, there's still the barrier of cost to setting up labs with the right equipment, the right training for law enforcement officers to move to test oral fluid in addition to or instead of blood. And especially right now, when states are cash strapped, that could just be a complete non-starter, at least in the near term. So funding is a big barrier for states to move in the direction of using oral fluid for drug testing in the context of impaired driving prevention. Next slide. So it's not just state laws that we need to think about as well. Now remember, there are 23 states where the law provides for the ability to collect and test drugs, either at the roadside or in laboratory in the context of impaired driving prevention or impaired driving cases. Sometimes agency policy is a huge barrier as well. And so we're going to talk a little bit about that now. Next slide. So the AAA Foundation did a study a year ago looking, it was really focused on sort of ways to improve data quality and availability on drug impaired driving. But part of that has to do with the use of oral fluid drug screening and testing. And as part of that study, we learned a lot about what some of the agency policy barriers are, not state law barriers, but agency policy barriers are to moving in that direction. And so one is existing backlogs at labs. And this is even in states where oral fluid isn't currently being tested. It's blood or urine. And if there's already a backlog, testing those kinds of specimen, introducing another isn't going to help that situation at all. So that's a huge barrier. The idea that not all of the technology is created equal. And even if you're able to educate people about the technology or the devices that perform well as compared to others that don't perform as well, there are still some law enforcement agency leadership that just don't buy into the idea of oral fluid drug screening and or testing. So there's lots of education there that would be important to overcome those. And then lastly, is if you have a driver who is impaired by multiple substances, and alcohol is one of those substances, and that particular driver's blood alcohol concentration is 0.08 or above, depending on the state, there's no legal incentive to continue the investigation for drugs other than alcohol. If the charge will be the same, the penalties and fines will be the same, the potential jail time will all be the same. It's just additional agency resources and time from the officer to investigate further. So that is a huge barrier to pursuing the drug charge in addition to alcohol if both are involved. Next slide. So the judiciary are really important as well. And one of the barriers, I think, to moving in the direction of the use of oral fluid to detect drugs in the context of impaired driving cases is, that Frye or Daubert hearings are real possibilities in many courts across the country. And this just refers to the ability to introduce certain expert testimony or evidence for use in court cases, on DUI court cases. So there's significant, I think, education that needs to be done for the judiciary as well, and for prosecutors throughout the country. And then moving to the next slide, the resources which I've alluded to before, just people, time, and money, both in terms of training, equipment, is a huge barrier for many states, and especially right now makes it really just a complete non-starter. Next slide. So I wanted to give one more case study, just looking at the state of Ohio. So in Ohio, policymakers are very interested in exploring, setting up an oral fluid drug testing program. So for confirmation purposes, for evidentiary purposes in the lab. Completely not at all bought into this notion of screening at roadside using oral fluid. And there's nothing wrong with that point of view. In the state of Ohio, they're looking to double down on basic police work. So just the standard field sobriety testing, knowing what to look for during the traffic stop, all of those kinds of things, sort of back to the basics. But they recognize the benefits of collecting an oral fluid sample because you can detect drugs that are more reflective of what those levels were at the time that an individual was actually driving. So just, the way that different states are looking at the use of oral fluid to detect drugs in the context of impaired driving cases varies all across the country. There are strengths and limitations to roadside screening using oral fluid, just as there are to confirmation testing in laboratories. Some states will do both, some will do one and not the other, and others will choose to stick with blood. And so my goal here today really is just to share with you sort of what those strengths and limitations are, not really to push states in one direction or another, but to understand that if you're going to move in the direction of exploring the use of oral fluid to detect drugs in this context, there are sort of right ways and not so great ways to move forward to achieve that. Next slide. So what are some of those strategies? obviously lots of education. And I think, starting with the basics about screening versus testing and making sure that we're really careful in the words that we use and the context in which we're describing oral fluid screening versus oral fluid testing, making sure that we have nailed down the details and we really understand what the results of oral fluid roadside screening can be used for and what they can't, is compared to what the results of lab-based testing can be used for in the context of impaired driving prevention in DUI cases. One of the best ways, I think, to avoid loopholes in laws like those that I gave you examples of a few moments ago is to get a diverse coalition of people within your state together to look at what other states are doing and to give some thought to carefully crafting the law changes, the agency policy changes required to get a program up and running. That way you can make sure that the benefits of the program or the benefits of using oral fluid to detect drugs are realized rather than hindered. For example, just going back to Vermont, by not allowing the collection of an oral fluid sample at the roadside versus, up to 2 hours after the time of the traffic stop. We need to realize that in many cases, the policy environment within a state is already conducive to using oral fluid to detect drugs. That the true barrier may have nothing to do with state law. It may be agency policy. It may be the willingness of law enforcement leadership. It could be barriers related to the judiciary. And so again, another benefit of getting a coalition together to dive into this a little bit deeper. And let's be honest, in many states, there are already groups of people, of stakeholders who care a lot about the topic of impaired driving and have a high degree of interest in drug impaired driving prevention that could contribute to these kinds of conversations and lead to well-run and developed programs. And also addressing issues like the incentive issue that I mentioned before, and making sure that we really understand what the benefits of roadside screening are versus lab-based testing once again. Next slide. I mentioned a moment ago that the AAA Foundation had done a study last year. It was published in December that looked at ways to enhance data quality and availability. And I think that's really important. And I want to say that Samantha addressed this a little bit at the top of our time together. If we don't have, good data on drug impaired driving within a state and certainly across the United States, then we really have no way to accurately understand the magnitude and scope of the problem. And certainly we have no way to understand how well laws or other interventions are working to address it. So as uninteresting as fixing the data problem might be to probably most people, it's wildly important to making a dent in this issue of multi-substance impaired driving and drug driving generally. Next slide. The AAA Foundation in next year will also be releasing a study based on a national survey of motorists that looks at the degree to which different motorists report engaging in certain risky driving behaviors based on their self-reported use of alcohol, of drugs other than alcohol, combining them, or using none at all while they're behind the wheel. So keep an eye out for that interesting work next year. And then my final thought to you, next slide, is just to remember that even if your state chooses to move into this area of using oral fluid to detect drugs, there are clear and certain benefits to doing that. But understand that doing so isn't going to allow you to treat drugs other than alcohol like alcohol, at least in terms of knowing how much of a certain drug or combination of drugs is in the body of a driver based on even a confirmation lab test. Doesn't allow us to make a determination about impairment using that information alone. So it is more complex, it is complicated, a little bit messy, but understanding what the strengths and limitations of using oral fluid to detect drugs, I think still can help you make the right decision for your state based on where you want to go in terms of curbing multi-substance impaired driving. So I'll stop there and hand it back to you, Samantha.
Thank you, Jake. And thank you. I'm sure that these presentations have sparked questions in our attendees. We were planning on doing breakout rooms, but the presentations were very encompassing, and I'm sure that the information you were given is very useful. So we're jumping immediately to Q&A. We have already a few questions, but if you have any questions, please put them in the chat box now. So we have a question that maybe for both of you. The question is, when will NHTSA establish measures on how to scientifically detect whether a driver is impaired after consuming marijuana, or should we invest more in drug recognition experts? And I mean, I think you cannot talk directly to when NHTSA will start doing this, but maybe you can just mention if you think that we will have a measure similar to what we have for alcohol, or whether independently of whether we start using oral fluid testing or other forms of testing, we still need to invest more in drug recognition experts. Go ahead, Darren.
Okay. You know, I don't know if we'll ever, and I don't know if it's really up to, you know, the National Highway Traffic Safety Administration to do that necessarily, but I think that's where we have to look at what the research and the data is telling us. And do we ever get an actual level to say, yeah, at 1 nanogram, at 2 nanogram, or at 3? You know, in Washington State, our public initiative put in a 5 nanogram level, and there was no research to support that. And so that it's interesting where we've seen states put in 5 or 2 nanograms, or they've just left it at 0 and looking at how, you know, looking at the officers as far as the impairment itself. And what officers should be able to do is be able to determine impairment absent a chemical test. And so they really are trained that way. And so the chemical test is just kind of icing on the cake, because if the chemical test got thrown out, can you clearly articulate that driver, that individual is impaired? Will we ever have numbers for cannabis, meth, heroin, all of those different things? I don't know. I don't know the answer to that. But I do know that we need to continue to invest in the training and the observation and the ability for officers roadside to be able to do that. One of the things that I heard in Washington over and over is, you know, if you're smoking cannabis, the officers don't have a way to detect it roadside. Well, we do. And so officers that are trained in recognizing this through good field sobriety test training, the advanced roadside impaired driving enforcement, and the drug recognition expert program, we need to continue to help invest in those arenas. We also can see where there's potentially the technologies, as Jake just mentioned, as far as oral screening tests. I mean, we've heard of, you know, cannabis breathalyzers. We've heard of all these different things, but really, you know, we've got to go back to the good old part of this is, can we identify that the person's impaired to begin with?
Jake, do you have any comments?
I mean, I agree with generally with the comments that Darren said. I don't think it's a matter of interest or willingness from NHTSA to have an answer to that question. I think if they could, they would. It's just super complex and really hard. I mean, our own research at the AAA Foundation tried to look for a meaningful number, concentration of active THC on which we could base a per se standard, and we couldn't find one. And it was a pretty rigorous analysis that we did. So I just think it's a tough nut to crack.
Okay, we have another question. How long will it take for roadside oral fluid testing to be accurate enough to be allowed in a court of law? Jake, maybe you have some thoughts around that question.
Well, I mean, I think that I'm not sure that there's value in having the results of a roadside screen become evidentiary, right? If you can collect a sample at the roadside after completing the roadside screen and send it to the lab, then we already have a scenario where those results are evidentiary. They can be admissible in court and be used in the context of a DUI court case. So I think we already have the opportunity to have, you know, the results of an oral fluid drug test be used in court. By nature of it being a screening test, I'm not sure that those results would be that there's value in trying to get those results in court, but using it to build probable cause for arrest or probable cause to get a search warrant, or to make a determination about whether or not to collect a second sample and send it to the laboratory, or to make a determination about whether or not to call a DRE to assist on a case, are all really valuable benefits of using oral fluid in the context of roadside screening.
And I want to be conscious of time, so this will be our last question for Jake too. I understand that we can't say impairment or can deduce impairment from an oral swab. However, could we say it is psychoactive in their system for certain? And I'm guessing the person asking is talking about states where there is a zero tolerance law or something like that. And then obviously there would be impairment in that case.
I mean, the reality is with the exception of alcohol, there are no drug concentration levels that we can make a determination at the population level that that driver would be exhibiting a certain amount of impairment or would be subject to a certain degree of crash risk. That information just isn't established yet. And just using marijuana as an obvious example, if you're somebody who uses all the time for fun, or just because you're a medicinal marijuana user, the outcome is the same. Your tolerance is going to be very different compared to somebody who uses every once in a while or uses for the very first time. So it will take much less of the impairing substance to create a psychoactive result as compared to somebody who uses all the time. So it's just messy. It depends on a variety of factors, even many beyond just whether you're a habitual user or an infrequent user. The amount of fat you have in your body versus muscle. There are all kinds of the other drugs that you're taking for, therapeutic reasons or otherwise, are all factors that matter. I think you're muted, Samantha.
Sorry. Yes, I was muted. I want to extend a final thank you to our presenters. We greatly appreciate the expertise each of you were able to provide. And thank you to our attendees for participating in today's webinar. We hope you found this meeting entertaining and informative, and we again invite you to join us next Wednesday for our traffic safety roundtable. Thank you.